I am Kath Rooksby. I work with NHS England South West as part of the South West Integrated Personalised Care team and support end of life within that role. I love the what kind of. I can't get enough of the what kind of. And I think because I find that the most sort of easy to pin. So recently, I find I'm using it in situations at the moment. So I'm within an organisation. So I have a lot of colleagues within NHS England South West who are all working to achieve good outcomes. I link with people outside of NHS England, and a lot of people are in sticky places at the moment. There's a lot of uncertainty. There's a lot of treacle. That's my descriptor. And I was in a conversation this week where through another person, we'd been brought together in recognizing the connection between dementia and end of life. And four of us were in this space, and one person was clearly just very heavy with, I don't know what we can do here. I know what my priorities are. You might know what yours are. I'm not really sure how we can come together. And she described how she was feeling about stuff. And I think she said the word stuck. And I just came into the conversation and said, well, what kind of stuck, Helen? Could you share a bit? And because of asking her that, I feel it actually helped her get to a better place in our next conversation in terms of what outcomes we could get to, because she'd been able to unpack a little bit of, she'd been able to lose a bit of her baggage of coming into the call.
Mm-hmm. And what about, is there anything else about? Have you an example of how you use that?
Yes. Well, interestingly, that's probably had as much a big impact in for me in my personal life as it has in my work life. And is there anything else about? I'm finding I've been using that with my children quite a bit. And it leads on from the um, well, generally it's sort of a how is your day and the sort of fairly short answer. And then I'm finding it really helpful to say, is there anything else about that? Because we definitely have a longer conversation, and then we actually get to some things which might be around a difficult lesson or some overdue homework or a bit of a challenge with a friend in the playground. And by that, is there anything else about? I've definitely had better conversations with my children.
How old are your children?
15, 17, and 19.
Mm-hmm. So we're not talking about youngsters here.
No, yeah, no, they can have conversations. They
But
choose.
also famously difficult to have conversations with
Mm,
teenagers.
yes, yes, 100%. When someone describes a problem to me, I ask them back, and then describe the problem. What would you like to have happen? What would you like to happen? I can definitely think of an example of using it. That's been more in one-to-one team colleague conversations. Um, and that's happened when a colleague has shared. So at the moment, we're going through a restructure. There's going to be a new sense of space. We're changing. We don't quite know where we're going to land. And there's been some conversations where I know I have used it on one occasion when the person has shared with me that sense of the role's changing and it's out of their control and they don't want the role to change. And so by trying to find some sort of, it is hope a bit in a way in terms of what might be coming next. But when they describe their feelings of, but I don't want to stop this job and I don't want it to not carry on, by asking, and when you say you don't want your role to stop as you're doing it right now, what would you like to have happen? And that's allowed the person to explore a bit more of the things that they would really like to hold on to. And then we've been able to explore that actually in the new world, there might be ways of holding on to some of those things. And it's sort of detaching that personal connection to the things they love in their role to potentially what the role might turn into, but morphed differently. Why I use them and the difference they make is that I genuinely feel that the conversation is now more led by the person I'm having the conversation with rather than me thinking I know what the answer might be, what the next sentence might be, or where the conversation's going. And so by using these questions, I'm experiencing very, very different outcomes and very different conversations that are then resulting in the person I'm having the conversation with genuinely getting to a better place.
What difference does that make when they're leading or they're getting to a better place?
For me, the difference that makes of them getting to a better place is that my role isn't to be, I don't think any of our roles in conversations is to be the sort of solution finder. And what I've experienced is that I'm learning more about the person I'm having the conversation with because of the way I ask, what kind of, is there anything else about? They're digging much deeper into what their thought process was in the first instance around why they gave the reply they gave or why they gave the problem they gave. And so, by the way of my asking what kind of and allowing them to dig deeper, I feel like they're finding more out about what it is they've come to me for me to have, why they've come to me to have the conversation. And my job isn't my job isn't, I don't feel, that the responsibility to navigate what the outcome should look like. That should come from it should come from all of us. How did I first get into it? Well, fortunate to be working with the very lovely Saskia Dorman, who's a palliative consultant in Dorset. And Saskia and I have been working together for a few years now as part of the NHS England South West network. And we've, over the years, we've worked really hard at creating strong relationships, good conversations, generative conversations with colleagues across health and social care, voluntary sector, people supporting, care supporting people at end of life, in the work that's happening to enable good end of life. And we have run a few events, and one of those events was an online event in November 2022. And Saskia had met yourself through some situation and had come across you and your book and the work you've been doing with Steve, and invited you to come along to our online workshop, which helped frame and have some conversation around a good death is like what. I mean, that in itself was just amazing, because you having an opportunity to spend 90 minutes with an audience that we'd brought together from across the Southwest brought out some incredibly generative questions around how we frame the question, a good death is like what? And we don't frame it like that often. And it opened up opportunity for people to really think about their own perception of what a good death might look like, as well as how they work clinically and otherwise in health and care. And from that, we ran a short course with yourself that we opened up to people who'd been on that workshop to participate in a 6 lessons around clean language. And that was a brilliant journey with a brilliant group of people. And I think there's some real strength in how when you get a group of people together who are interested and curious and are keen to learn more. And we grew definitely as a group in terms of our understanding of clean and practicing and really testing it out. So that's how it all came to be. And I've surprised myself actually how much it's then become a part of me, and I'm really happy about how it's become a part of me, not just at work but in my life, because I think if I want to be the best I can be, that's about how I have a conversation in any context, whether it's with my husband, my children, my friend, my work colleague, my dog. It goes across the board for me.
Now, we've been collaborating on spreading this more widely within the health and care sector, really, not just the NHS, indeed. Why do you think that the sector or the NHS or both, why would they bother with more of this?
Why would health and care bother more with clean language? Simply because it is the right thing to do because it means we're working in a personalized way. We're I think one of the challenges we have is that we have so much policy, so much mandate, so much if we do this, we'll achieve that. And we do sugarcoat quite a lot in terms of how we might do that. And so if we were to take the comprehensive model of personalized care, which is I believe isn't rocket science, and it's very much about what's at the heart of what matters to an individual. If conversations can be framed in a way that enables the person who's at the center of the need of care has is heard about what matters to them. Clean enables that conversation to happen in quite a simple way. So it's this, it's this headspace of recognizing we're not doing to people, we're listening to people. And clean enables a really simple, by asking what kind of, and what resonates for me really strongly is our colleague Siobhan, who's a palliative care nurse down in Cornwall. And when I've heard her say how using clean has really changed her understanding of patients and their symptom control, pain management, because of how she's asked the question, what kind of, that's it for me. And if we could have that in every context of our health and care communities, we would get quicker, faster. We'd actually save money. We'd improve people's quality of life, and people would probably be more empowered as well, because they'd have had control in the conversations around what services and care they were going to receive.
So quicker, faster, improving people's quality of care, improving people's quality of life, and empowering them. And what the meaning I make from what you say is that clean provides a how for doing that.
Yes, clean does provide a how for doing that, because the key word that comes to my mind is choice. So the clean provides the how, because then there's opportunity to really understand what choice it is the person wants or needs. So, and we could give this as an example in terms of choice with regards to end of life, and a person's choice as to whether they really do want to go into hospital, or it's because the paramedics think they should go into hospital. And we know at end of life there are too many admissions to hospital in the last 90 days of somebody's life, which I couldn't say if there'd been a clean language there would have been a different outcome. But if we were able to have conversations with the patient at a point of crisis that was clean, the outcome could have been a better choice. So yeah.
And that better choice then leaves them in a opting for the thing that they actually want rather than the thing that somebody else thinks is best for them.
Exactly.
Which also coincidentally happens to probably be cheaper. Save the health service money.
100%. Yeah. A night in hospital is not a cheap option.
And leaving aside all the effects on the family and all the rest of it. Is there anything else you'd like to say about clean language in the health service, in the way you use it?
Anything else about clean language? I really look forward to spreading clean language in our health and care communities. I'm finding that meetings I'm in, calls I'm on, I'm started, I do drop it in. And what's great is having a resource like some short videos, that because we all engage through, well, what's in it for me? Why would I take the time out to look at this? And why do I want to change my methods of communication? And there's something about the resources and tools that we're building where I feel I can drop those into conversations. I feel like it's one of those things that you sort of don't know it until you realize it with clean language. And it just sort of feels that it's just such a positive way forward. And particularly at the moment, with complex times, challenging times, resources getting tighter and tighter, if we could move into more of a world of having clean conversations, then it's going to help break down that complexity. So I'm just looking all the time at where I can drop in. Have you heard of clean?